Hi, this is Kent Kingsley with My Medigap Consultant. Thank you for watching the next video in my series. Today I want to go over your Part D drug plan, and this is sort of a DIY, a do-it-yourself introduction to Part D and how to do it on your own. It's a pretty simple process and I think you'll enjoy it, so let's just jump right into it. So when should you enroll in your Part D drug plan? Let's take a look at that. For the purposes of this video, I'm only going to go over your initial enrollment as well as the annual enrollment period. Those are the two times that I'm going to address in this video. Your initial enrollment period starts the first month that your Medicare Part B starts. So your window to enroll in a Part D drug plan is 3 months prior to Part B going into effect, the month it goes into effect, and the 3 months after. So, for instance, if your birthday was April 15th, your Part B is going to start on April 1st. So you can enroll in a Part D drug plan starting January 1st all the way through April, and then May, June, and July. So the end of July would be the end of your initial 7-month enrollment period. You'd want to enroll in a drug plan by then. I recommend you do that at least 2 to 3 months out prior to Part B starting. So in this case, either January or February. Go ahead and get it done. That way, come April 1st, you've got everything in hand and you're ready to go with your Medicare. Now, once you're already on a drug plan, you won't be able to change that plan during the middle of the year. You only have one time to change that for the most part, and that's going to be during your annual election period, which is every year between October 15th and December 7th. So I recommend you put that on your calendar to just remind yourself every year to review your drug plan. You can make changes to that drug plan, go to a different carrier if you need to, during that window for the following year. So between October 15th and December 7th, any changes that are made there will start the 1st of January of the next year. So let's look at the different ways to research and enroll in your Part D drug plan. The first option is really just call Medicare directly. Their number is simply 1-800-MEDICARE, which is 800-633-4227. They're open 24/7 so that you can call them anytime during the day. You just call them, tell them you need to enroll in a Part D drug plan. They'll ask you for your information, your prescriptions, and they'll pull everything up for you and let you know what plan looks like it's the best for you. Option 2 is going to be just to contact your local ship agency. So in order to find out what that is, just type in Google the name of your state and SHIP contact, and it'll pull up who you need to contact, and they can also walk you through it as well. A third option is going to be just to watch this video and do it yourself. I recommend you watching this video whether you use option 1 or 2, just so that you get an understanding of what's happening if you were to call Medicare directly. So it's pretty important to do this, again, just to know what the background of everything is. So let's look at the basics of a Part D drug plan. This video is being shot in 2017, so this is at a minimum of what Medicare states that each drug plan must cover, the basics that it must cover. Now, each carrier is going to cover it a little bit differently than what we have here, so don't get bogged down into what these numbers are. You don't have to memorize anything, but I just wanted to cover the basics of what Medicare says each carrier has to cover. So if you look at this chart, you've got a maximum deductible that they can have on a drug plan is $400. The initial coverage period, you're going to pay 25% of the drug cost, and the plan pays 75%. Again, these numbers are going to be different once you're on a drug plan, but this is a minimum that the plan must cover. Once you have reached $3,700 in total cost, now that's you plus the insurance carrier have paid $3,700 for prescriptions, you enter the famous donut hole. I'm sure you've heard that term a lot. And while you're in the donut hole, you're going to pay more for your prescriptions. So while in the donut hole, you would pay 51% of generic cost and up to 40% for brand cost. So once you've reached up to $4,950 in total annual out-of-pocket costs. That's you and the insurance carrier have paid out $4,950. You enter into what's called catastrophic coverage. While you're in catastrophic coverage, you pay either 5% of the cost of the drug, $3.30 for generics, and up to $8.25 for brand name drugs, whichever one is the most. So if it's a 5%, if it's a $200 brand drug, you pay 5% of that, which would be $10. So you would pay $10 instead of the $8.25. Okay, so what I want to review here is going to be doing it yourself on Medicare.gov's site. So the first thing you want to do is just go up here into your URL and you want to type in www.medicare.gov. Okay, once you're on Medicare.gov's site, the place that you want to go to is you want to click the Find Health and Drug Plans. It's this little green box right here in the middle of the screen. And once you're on that, it's going to enter into what's called the Medicare Plan Finder. So this is going to be where you're going to do your prescription drug coverage. And you just want to put in your zip code here. Hit Next or Find Plans. And then once you're in it, it's going to ask for some basic information. You just check that you're on Original Medicare because you've got Original Medicare A and B. You don't need to do any of this optional information. And then most people are going to put, I don't get any extra help. That you would look at some of these other boxes. If you qualify for any type of Medicaid or Medicaid assistance, then you would choose that. But most time you're going to be choosing I don't get any extra help and just click Continue to Plan Results. So on step 2 of 4, you want to enter your drugs. So I'm just going to enter in a couple common prescriptions here. So right in this little box down here, you're going to type in the name of your prescription. So let's use a common statin, simvastatin for cholesterol. And you just choose it. It starts pre-populating it once it starts recognizing what you put in. And we're just going to leave it here at 20 milligrams and take 1 per day. And you just click Add Drug and Dosage. Okay, it'll take a second for it to upload and you'll see that it's added the prescription drug down here in your drug list. Okay, and you take 1 per day at a retail pharmacy and it's already a generic. If it's a brand drug, it's going to put in that it might have a lower cost generic option. But what you want to put in when you're putting your prescription drugs in here is make sure that if you take a brand drug, type in the brand drug. If you have to take a brand, put in the brand. But if you take generics, make sure you put in the generic version of it so that you get the best results based on what you actually take. Right now is a good point for me to point out this part over here under this saved drug list. Medicare.gov issues you what's called a drug list ID and your password date, and all that is associated with the zip code that you put in. So I would encourage you to write this information down in your notes and just put it in your Medicare file, because if you take a lot of prescriptions, you can put this information in here, or even if you call Medicare.gov, you can give them this information and they can pull up your list that you had last put in there, and then you don't have to type in the 5 or 6 different prescriptions or 15 depending on how many you have. You don't have to type that in every year. So I've got simvastatin, and let's add one more. We'll add lisinopril, just regular lisinopril, and we take 5 milligrams of that. We do 1 per day. Okay, so I've got the 2 prescriptions that I take, and so I don't take any more. I'm just going to click My Drug List is Complete. Now, if you've got more than 2, you just continue adding until you are complete. And click My Drug List is Complete. The next step is you want to choose your pharmacy. So if you use, let's say in this case you use Harris Teeter, and we're just going to put Harris Teeter up there. If you want to compare other pharmacies, see if some of them are less expensive, you can do that. You can only compare up to 2 at a time. So you just hit Continue to Plan Options. And here you're going to choose the top box. You want to look at the different prescription drug plans that are available with Original Medicare. So you've got 22 plan options that are available here in North Carolina at this time. So you just click prescription drug plans and continue to plan results. Alright, so basically now what it's saying is you can see my current profile information is that drug list ID and everything's up here. And then if you scroll down, it is going to compare these plans with the lowest remainder of the year retail cost. So if you're doing this in the middle of the year, it's going to show you how much your prescriptions are going to be. Now I want to point out that again, it's got it sorted based on the lowest remainder of the year cost, and that's the most important figure, not really what your monthly premium is. That's a big mistake, is just looking at the premium, because you want to know what the cost is, premium plus the cost of your prescriptions, and that's what this number shows you. So with these two prescriptions for the rest of the year, as of today, this would cost me $91 with this plan. You can see here on the Cigna Health Spring plan, it would cost me $116. And here on the WellCare plan, it's going to be $818. So I want to look a little bit further into this Humana Walmart plan. The other things I want to look at is one, to make sure that all my drugs are on the formulary. So they are. So that means that this plan covers all of my prescriptions. Are there any drug restrictions? Yes. So we'll take a look at that in a minute. Typically, drug restrictions are quantity limits. So with this Humana Walmart plan, you notice we put in CVS. We don't have to use Walmart. CVS, we can still get good pricing. Now, you might on this plan get a little bit lower prices with Walmart. So again, I would play around with the different pharmacies, see if you can save some money. If you're on all generics and there's only one or two, it's probably not going to make that big of a difference. But if you are on more, then it very well could. So what this is showing me, that when I'm on this plan, I'm going to be able to pick up these two prescriptions for $1.68 for the lisinopril and $3.96 for the simvastatin. So $5.64 is what it's going to cost me for these two prescriptions each month. This chart here I like because it shows you really what your overall cost is. Again, you've got the $17 premium, and then you've got the $5.64. So if you take those two numbers and add them together, what's that, $22.64, and you multiply it by the 4 months, that's going to come out to the $90.56. So again, that shows you that this number here also includes the $17 monthly premium. So don't get bogged down on what the premium is. You want to worry about what your overall cost is. Now, in order to enroll, you've got a couple different options. Again, you can still call 1-800-MEDICARE. You can give them your drug list ID number right here, and they can pull this up. They can do it for you. You can call the carrier directly. Just call the non-member's number. You can call them directly and they will enroll you over the phone. You can also enroll right here online. You just click the enroll button and it's going to take you to an enrollment application for you to enroll. And it's pretty self-explanatory. It just goes right through it. Again, you're going to choose your initial election period. In this case, you're new to Medicare. Click that, and then you just come down and you continue to enrollment. I'm not going to obviously go through this any further, but here you just fill in your information and just go through the application. At the end, it's going to give you a confirmation number. I would just write that down or print that page out, but it's going to send the enrollment directly to the carrier, and then you will receive your policy and ID cards. So you have a couple of options. Enrolling this way through Medicare.gov, you can only set up your payments to be made from your Social Security payment. So they'll take the payment for your Part D drug plan right out of Social Security, or you can have the carrier bill you. Now, if you contact the carrier directly and enroll over the phone, Most times they will be able to also set up a bank draft if you'd rather have that drafted out of your bank. So those are your options there. So that's it. I hope this walkthrough into researching your own Part D drug plan was helpful for you. Now that you've watched it, feel free to try it on your own. Call Medicare directly. You can always call me as well. I'm here for you. Again, you can enroll directly with Medicare by calling 800-633-4227. You can do it yourself online at medicare.gov and use that plan finder tool. Pretty simple process. So what's the next step? As always, feel free to give me a call at any time at 888-557-4812. You can also send me an email at kent@mymedicapconsultant.com. Please take the opportunity to again, try it on your own. If you have any questions on this, please don't hesitate to give me a call. Again, I would be happy to answer any questions that I can and guide you in any way that I can. Thanks. Have a great day.